All right, good morning, everyone. This is Dr. Fox. Welcome to CRPN Central Live, the podcast where we discuss with some of our industry's finest what we can do to help create, be innovative, and importantly, help each other. Today, we're going to have a follow-up interview with Henry Kravchenko, Michelle Shogren on innovation disconnects. It's been a while since we've had the interview, so would you be willing to introduce yourself to the audience?
Sure.
Go ahead.
Michelle, please.
Michelle, go ahead.
So, my name is Michelle Shogren. I am CEO and founder of Innovate in What You Do, and we help companies drive innovation to implementation through the use of user voice change management and strategy. And in my past life, I've spent some time on the site side of things, CRO world, pharma world. I've been a patient and a caregiver for clinical trials as well. So, I'm excited to be here and try to figure out how we can make the world a better place going forward.
I agree. And Michelle, I want to make it an objective, not a goal, but an objective to attend some of the Innovate in What You Do workshops. I've seen what they do for their attendees, and I want to be a part of that. So, Henry, would you be willing to introduce yourself?
Of course. Hello, everyone. My name is Henry Kravchenko. I am the CEO of Clinically. We are an eReg and eSource provider for clinical research sites. We focus primarily on sites, and I shouldn't say just eReg and eSource. I think we look for ways to help sites by employing technology in ways that complements their operations rather than disrupts their operations, as a lot of times technology does.
Mm-hmm. And Henry, I have to say, my favorite Henry quote ever was, "Sites are our primary, secondary, and tertiary stakeholder." That's, clinically is here 100% for the sites, and they're here to listen to the sites, which I think makes for a perfect interview for today. So let's recap a little bit on the interview that we had on Innovation Disconnects. First, we interviewed with Henry, and we talked about innovation disconnects, maybe from a tech provider trying to help the sites to figure out what we can do, how we can help them. And then we talked to Michelle, an expert in innovation who has literally developed entire workshops for them to understand how we can see innovations, how we can help test them, how we can properly execute them, what we can do. So it was a brilliant interview when we talked. Henry, you were all about going to the sites, listening to the site voice, and literally creating for the site what they needed based off of what they told you. And Michelle, you complemented that by saying we have to listen to the voice of someone who does it. My favorite quote that you had was where sometimes in the industry we're like, okay, uh, I know what the site has to say because of my perspective of them, because of how I view them. It goes with patients, it goes with sites, it goes to however it might be, but it's always like a secondary opinion, an observation of someone, not necessarily what that someone is telling you. And I feel like those two were very complementary to each other. So, Michelle, first I want to pass it off to you to elaborate, maybe kind of like what Henry was saying, where he went to the site and he listened to what the site had to say. Could you elaborate on how that applies to what you said about like listening to the primary source?
Absolutely. So a lot of times we are creating things with the users in mind, and we're trying to come from a good place. We're trying to think about them and what their world is. And we may think we know them quite well. So with patients, our doctors are constantly saying, oh, I know what the patient needs because I'm their doctor and I see them. But their doctor only sees them when they're in front of them for that short amount of time. They don't see them through their whole life and their whole journey. The same thing happens with CRAs saying, hey, I know my sites. I go there all the time. I know what they need. I know what they want. But again, they only see them for those moments in time and what is on their agenda at that time. So you have to really be intentional in how you gain your user voice in order to really drive adoption of new ways of working, because you have to make sure that you even solved a problem in the first place. Did you reach an unmet need and deal with that for them, or are you just adding more chaos on top of their already chaotic world? So I love that Henry's out there talking to sites, finding out what's going on, and really, designing based on that. So.
Mm-hmm.
it's funny. Funny, I don't know if that's the right word, but it's funny to hear you say, Michelle, to ask that question, like, did you actually solve the problem? Because I think sometimes you're so right. Folks, they assume that they know what the problem is. And they assume whatever they did solved it, but nobody actually stops for a second to figure, is this really the problem? And then, did I actually solve this for you? And that, to your point, just adds more and more just complexity.
Mm-hmm.
And we do that in all kinds of places, right? I mean, think about it. If we start getting sick, right? First thing we do is we try to treat the symptoms because that's the easy way out. So we say, oh, I have a runny nose, I have a stuffy nose, I'm going to take a little antihistamines, right? And you think, okay, gosh, why am I not getting better in a week or so? Well, because you treated the symptom, you didn't treat the underlying problem. Maybe you actually had a sinus infection that needed an antibiotic. And by treating the symptoms, you get a temporary relief, but you don't get the real big relief that's necessary. And I think that happens quite often when we're trying to create things, especially in the site world, because you see all these little pain flare-ups come up, but we need to take the time to dive in and find out, well, what's causing those pain flare-ups, and is there a bigger systemic issue, or can we just treat the symptoms?
That's like straight up root cause analysis right there, when you go into look and what is actually causing this. So Henry, I had 2 questions for you. Number 1 is, how many sites have you visited to try to develop your product? How many sites?
Why is that in past tense? Like we're still developing the product, and I'm still visiting.
Maybe how many sites have you visited, and how many sites do you want to visit?
So, how many have I visited? I mean, dozens at this point. Well over 20-ish, I guess, at this point. Not all of them are customers, by the way. That's the other thing just to note. And how many do I want to visit? Honestly, like, that's the interesting part. Like, the world that we live in keeps changing. So just because I visited 300 sites 2 years ago doesn't mean that tomorrow I know what sites want. That doesn't mean that I knew what sites wanted 2 years ago either. The point is, like, as the world, technology changes every day, and just the business, right? The research changes, medicine changes every day. So it's not a bullseye, it's not a static target. It's a moving target that you have to constantly keep on top of to make sure you understand, what you should be doing and what your industry wants. I don't want to say customers, right? At the end of the day, you don't have to be our customer to have the same pain points as our customers do. But it's important for me to at least to understand what what are folks frustrated by.
So that's my follow-up question, and it kind of goes back to having to understand not only if you're solving a problem or a symptom, but also maybe when you go to these sites, and you've been to a few of them now, what questions do you ask these sites to try to get down to the solutions you're trying to develop? Like, sometimes it's all about asking the right question with these sites. What have you found that's been successful to try to identify exactly what you're trying to solve as far as the questions to ask?
I mean, the why is always like, why do you do this? Like, that's always, honestly, that's the first question. Second question, like, that's always such an important question to ask. It's not how do you do this, it's why do you do this? And then subsequently, a lot of times why will be because the FDA wants us to do this. Like, okay, but why do you do it this way? Like, what is it about this approach? What I've also found is that, like, asking questions is a little tough because people get defensive about their approaches, their systems, their methods. So it has to be open-ended questions. So, like, I try not to lead folks. Just like, can you explain to me how you're doing this, and why is it? Why? A lot of times I'll say, why does it need to be done this way, right? Because I want the folks to open up and just tell me just honestly what's going on, and then that a lot of times will reveal just like the inefficiencies in their approach or the shortcomings in their approach. But generally, any question I'll ask, I'll try to make it as open-ended as possible, so that they can. So I don't want to poison the well with my bias of how it should be done or how, like, again, back to Michelle's point, like, as soon as I see something, like, just like human nature, like, oh, I know how this should be done, but no, I don't. I'm not a research professional. I've never been in this field. Also, this might not be the way that she wants to be done. So it's super important to get my bias out of it and just ask open-ended, non-leading questions, and that helps.
Mm-hmm. And as you go through that process where you're asking these questions, do you ever have an experience where the sites actually start to realize things when they answer it for you?
That ever happened? It's a great question. Yes. But a lot of times it'll be like, well, the FDA, this is inefficient, but the FDA wants, it's always I feel like regulatory, regulations, the regulatory environment is always an excuse for doing all this extra work. But at the end of the day, they just want this data captured, logged, preserved. They don't specify how exactly you should capture it. So that becomes more of a comfort level, right? People feel comfortable because they take a pen, they write this data down, they know it's there going to be there for the auditors to come in and look at. But now I have to get them comfortable with well, no, because you've uploaded this document, the system's captured that information, so you don't have to write down the upload the time of a document, because that's what computers do naturally. And then you show that to them, and again and again and again, and they get comfortable. Like logs are a great example of that, where ICF logs, we have to keep, or any CVs, we have to keep track of prior versions of a log.
Mm-hmm.
The system does that automatically. Every system does that. That's natural. So you don't need to keep a separate document to log exactly what the system logged. If anything, you are guaranteed to be wrong sometimes, because the system that's the source of truth. So it's these kind of examples of where you just kind of A, understand the problem, and then B, show them well, no, we can do this. We do this naturally already, and here it is. And then it takes a little bit of time, and then they get comfortable with it, and then they trust the system.
And I wonder how many times, Michelle, you may have heard this too, but I wonder how many times the answer was, well, we've always done it this way.
Oh my God, so many times. So many times. And that must be the way that we have to do it now, because we've always done it this way.
Mm-hmm.
But I really like what Henry said about asking them more questions, because so many people approach user voice as a verbal survey where they have a list of questions they want to know, and while their person is responding, they're already thinking about what's the next question they're going to ask at the same time. And so they're not really hearing and following anything. But when you ask those questions, especially, I love any kind of journey question or process question with, like Henry said, tell me how you did this, or tell me why you're doing this. It'll take you down a different journey than we know not to ask closed-ended. At least we should by this point know not to ask a closed-ended question unless it's a confirmation of, did I understand you properly? That's okay to say yes or no. But otherwise, those open-ended ones are good. But I think also what Henry does, other people need to do too. When possible, observation is the strongest user voice that you could possibly get, by just being able to observe how they're working and what their workarounds are, in order to say, oh, okay, well, why didn't you go this path? Why did you do this other side thing? Oh, well, because if I went this path, it would cause these problems. So I created a new path for me. All of a sudden, now you're seeing the new sidewalk being built that's in the grass instead of the concrete one we're supposed to be on. So observation is great. And if you can't do that, really having those opportunities to ask the process questions and understand why. And to your point, Dr. Fox, as far as it goes, those light bulb moments, I have a shirt, I live for the light bulb moments, because when you're asking these questions, they do self-realize a lot of times that, oh, maybe there's a better way to do something, or, oh, maybe I don't have to do it this way, or, oh, maybe that's just the way we've done it before. And that leads to progress and to change. And it also helps your change management activities tremendously, bringing in new ways of working when they self-identify there could be a better way. So really love that commentary.
So Henry, go ahead.
I just want to add to that I should have said earlier. I think observing somebody work that's the ideal. It's a lot of times when we might be discussing a completely different topic, and I'll just see them navigate through through our product, and I immediately see like their frustrations, like what's wrong, because you could see that folks hesitating somewhere, like, so they don't know what they should be doing at that screen. So it's stuff like that. Like, you can't hide. When you ask somebody a question, they can make things up just by acting, not intentionally, not maliciously. They'll just make things up because that's what they think they do or why they think they do. But when you see them work, that's the truth, and like you get so much out of it.
Mm-hmm. And I'll tell you, Henry, at some point when I start up my site, when it's all up and running, I'll let you be an honorary coordinator for a day or two. You
I
be
would
a
love
coordinator.
that.
You run through the whole thing. I'll even let you run through clinically, and you'll be like, "Why in the world did we design it like this?"
I bet you I'll find stuff, and it's gonna hurt. It's gonna hurt, but
it's all about first
happen.
person. That primary source of information, going to the primary source, not secondary source, primary source. So Henry, I remember in your interview, and we talked about this a lot. We actually use the analogy of the internet, the analogy of credit cards, the analogy of some kind of an environment where we all agree to a standard. We all agree that there's this infrastructure that we're all going to follow. I think you called it protocols. And then we're all going to follow that accordingly and become best of breed, become what we're really, really good at. Focused to focus on the problem that we're solving specifically, and not necessarily on credentialing everyone doing the individual credentialing. So to a point, and this is where it's an interesting balance. That's kind of like a point solution, but it's a point solution that's dependent on an ecosystem. And I don't necessarily think that we as industry are doing that yet. We don't have that standard that everyone is following, like Google or anyone else with the credentialing processes. So my question to you is, from that perspective, how can we innovate in a point solution system and maintain the fluidity of the industry where we can all work together on that same platform? Do you see a world where that's going to happen?
I do, because at this point, I see the gap, and I don't think it's that difficult to breach that gap. Just so why don't we breach it? I don't know. It's part of just old way of thinking, like this is how we do things. But yes, I do see a world where systems are tightly integrated. Like discrete systems are tightly integrated. So you can use your preferred vendor, and it'll still talk to the EDC and that sort of thing. Like it all works together. That's effectively, going back to our conversation, that's the financial services industry, right? You have a bank account, you could transfer money from your bank account to your Venmo account to your credit card and pay your bill. There's dozens of systems behind the scenes that you've just utilized, but you don't know, nor do you care. Like you just need to put some money on, pay a bill. Like, you don't care how the sausage is made. And I think we can reach that here as well. I think part of the hiccup is that when I talk to sites, a lot of times they try to get into the weeds of, well, the system should use this approach to talk to this other system. But again, like, take a step back. Like, you as a site, do you care how like system A talks to system B as long as they talk? And the issue with going too deep into the weeds is that a lot of technologists, a lot of vendors will just push back because maybe the approach that the user is suggesting is not the optimal approach, and they'll focus on that versus like taking a step back and saying, well, no, the idea is good. The implementation, like, yeah, but that's not your forte anyway. But when you switch the focus from the idea to the implementation, that's when it gets lost. Whereas you as a end user just focus on, these are my needs. I need these two systems to talk. And then I think that if enough sites, enough voices are out there are beating that drum, it'll, as vendors, you have to adapt or you will die out. But if the sites keep going deep into the woods, into the weeds, and asking for specific, screens, interactions, capabilities, that's when I think the waters get muddied, the waters get muddied, and the conversation doesn't move forward.
So I heard two of the pillars in Henry's answer: ideation and implementation. So tell me, Michelle, given after what Henry was saying, is there any way that we can apply this challenge to the four pillars of innovation?
Yeah, so extra kudos to you for knowing the four pillars of innovation. I'm so proud of you. But yeah, and the interesting thing is, most commonly when we talk about things, we do end up hearing those two pillars. And the gap that's in the middle is incubation. That's it starts with intention. So setting our intention and what we're doing and the infrastructure to be able to support innovation. Then it goes into ideation, coming up with new ideas or new opportunities, that could be solving problems. Then we have the implementation of those ideas at the end. But in the middle there is incubation. And that's where we're really taking the time to test things and to find out, does this fit in the other person's world and what have you. So the interoperability topic is one that sometimes will need lots of incubation, because you have to figure out, how do we get that right? And maybe the way you wanted to draw a house is different than the way I want to draw a house. But if they're both houses at the end, what does it matter, to Henry's point, right? As long as the goal was met, we're okay, right? Just because one's a little fancier house than the other one, if they're both houses, we're good. The biggest piece with the incubation and the interoperability part is still trying to provide something that feels like a one-size-fits-all approach, that is not a one-size-fits-all approach, because you don't want to customize everything that you do out there. It takes too long. The upkeep and the maintenance for those situations are too great, too much risk for errors and omissions and other problems if everybody has a very different instance or a very different connection. So whenever we can try to have as few of those options as possible, the better. But I also don't believe in a one-size-fits-all approach. I think sometimes you have to have some variation. But if we can limit those, that would really help us dramatically compared to what we have now. By taking these principles in and applying them as we're going through it, that's going to help lead for success. And through that incubation period, that also sets you up for success for adoption, because we've hit too many times Pilotville. And I'm sure, Henry, you've experienced it, where people are like, well, let me pilot this in something. Let me just try it one time in something. And they want to have the taste of it, but they don't want to commit to eating the whole meal. So we want to get them to say, I like it enough that I want to have this meal, but I want to buy a whole meal plan. I want to be able to come and eat at this restaurant whenever I want, right? So in order to get to that part, you have to escape Pilotville and get the change management and what really matters correct. And the best way to do that is through the user voice that we talked about at the beginning.
And I wonder, after what you were saying, it sparked something in me. Whenever it comes to trying to create a solution for something, you literally just perform an entire brain dump. You throw all of the ideas on the table. You create as many ideas as possible until you've exhausted your imagination. And then you start putting the pieces together. So, one of the things that I've always wondered is, when we go to create innovations in the industry, how many options are on the table before you select the one that you want to pursue? Do you just be like, I have this one idea and I'm going for this? Or did you create 10 of them and then select the best of the 10 and then follow that? What do you think, Henry? Like, when you go for optimization or solutions, do you have all kinds of things to pick from? Kind of like what I tell my kid when they go to the store, you better shop around and then select what you want. Don't just go buy the first thing you see. You might see something better. What do you think as far as the design of innovation for optionality before you put resources into something?
Such a great question. Well, so yes, I agree with Michelle. Like, I think part of it is we need commitment, but I think it's difficult to commit to something because just inherently, just humans, we don't like change. That's just natural. So I think it's, and I don't know if it's even the question of there's too many choices. What I'm trying to get to is that I think a lot of times folks like shoot for the stars and just leave like just perfectly good ideas just by the side of the road because they just want to reach this like utopia of like everything talks to everything and everything's beautiful and the world is just a beautiful place. But it's just that's not how, at least my understanding, like my experience with innovation, at least that's not how it typically works. It's a lot of times it's not it's not it's not revolution, it's evolution. There's a lot of times baby steps, and then at some point you turn around and you're like, wow, this is revolutionary, right? Like the iPhone, like everybody has it, it's ubiquitous, and it does so many things. It didn't start out this way at all. Like it just, and I think people just look at these products that succeeded, like Amazon. It's just a huge behemoth, does everything for everybody. The iPhone, and there's like, this is what we're shooting for. But okay, but how do you get there? And I think people just forget the baby steps that you need to get there, and as a result, you end up failing. So it's not necessarily it's not the the breadth of ideas or the breadth of the problem. It's really just the focus that's an incremental innovation that's, I think, is missing. That's handicapping the industry from moving forward. I hope that made sense.
It does.
There's a lot to your question, and I'm not even sure I answered it.
No, I agree completely. And Michelle, I had so many thoughts on this, but I want to hear your thoughts.
So, I did the Today Show at D Farm for a few years where I hosted it, and we brought different people up on stage, and we got to hear from them their thoughts on innovation and what the future holds. And I interviewed Jagat, who's the CEO of Savoda, and he made a comment that he wants to have disruptive innovation without the disruption. And that's what we need. I loved that quote. That's when you think about bringing things in and making things happen, that's kind of what we need for the psychological background of people coming into new ways of working. If people are too disrupted sometimes, too fast and too furious, it can stop everything. And it might have been really wonderful. And if we also look at the history books, when we talk about innovation, it's not the people who invented the thing that's usually in the books, right? It's the people who made that invented thing now usable, right? Where they showed the value proposition, they made it cost effective, they made it, adoptable because the user experience was okay. So in order to get to that part, we have to do the iterations, we have to build up. And when we are doing user voice workshops right now, we're constantly talking to different users across the spectrum, whether it's patients, sites, study teams, whatever. We're finding out that people are saying, you know what, there's just so many bells and whistles. I just want the essence of what this is supposed to do to work properly before I worry about all these extra things. So some of it, I think, is because of the fact we're living in a world right now of exponential growth with technology, which is an exciting time to be here. And the future is so big and bright, right? But we have to go through the process of weeding out what's not working and what doesn't provide value, and, kind of maybe trying to help things grow that has the possibility to grow. And through this piece, people are also in what's called red ocean. So there's this theory, I don't know if you've heard of strategy, red ocean, blue ocean strategy. Red ocean is like shark eats shark. There's blood in the water because there's so many people that are exactly like you out there. And you're having to fight. So that's where all these bells and whistles come. Blue ocean is where you say, okay, I do something different. I give a different level of service, or I have a different way of working completely. So now it's blue ocean because there's no one there in shark infested waters with you. And we're trying to find little blue patches in this red ocean right now. So it's kind of interesting. So.
Yeah. And so what resonated with me, and someone told me once that changing things, it's like you're on a cruise ship. And if you hit the rudder too hard, you're going to break the rudder. You have to do very small incremental changes. And Henry, when you were talking about that, evolutionary versus revolutionary, I think there's one really important thing to note when it comes to innovation, and that it is not a one-stop shop. We do innovation once and we're done. It's continuous. It's these little bitty micro steps that maybe solve one problem in the red ocean that maybe turns a little bit of the red blue, and then just keep on moving closer and closer so that people can adapt to what you are trying to change. Also, what you were saying, I'm sitting here, I want to be like this big multi-billion-dollar company. I want to go from startup to multi-billion dollars. I want to be like those articles I read where these people pretty much won the lottery and did all these wonderful things in such a short amount of time. That's very rare. What you don't see about these big companies, iPhone, Amazon, these things, what you don't see is the struggles they went through, the failures they had, everything that they did. You cannot be impatient with innovation. That is not one of the pillars. That is not one of the eyes of the pillars is impatience. You have to continually do this properly. I have a question for you. Our audience has a question, and this is an interesting one. Angelo, thanks for tuning in, Angelo. Angelo asks, why do you think current vendors haven't solved the most pressing problems in this industry?
Oh, that's a good one.
So what do you think, Michelle, Henry?
I can jump on this really quickly. What I'm seeing is span of influence affecting a lot of that. Some of the biggest pressing pieces that we have right now are beyond our individual span of influence. So we actually have to collaborate together, and we have to play well in the sandbox with other people in order to get things done. So when you look at just having clinical trial awareness, we need that at the top level to be able to do anything in our clinical trials, right? But to get proper clinical trial awareness, we have to figure that one out. Then patient recruitment is another one. It's another thing where we have to work well with others to be able to figure out how can we recruit patients as good as possible without having to compete in this world. Some of our e-systems, our e-clinical services, it used to be that we had problems. I remember going out and monitoring at a research site, and my coordinator had to go to the back corner of the parking lot to upload the e-diaries because it was the only place that she could get a good signal, because we were using just one provider. We were using AT&T, and that was the provider of the chip in the tablets, and AT&T didn't work good there. And so it was crazy to make them go out there. So some of these little things, like we can't even get internet right, but part of the internet right is also somewhat out of our span of influence. We have to work on that. But I think really mapping the must-need basics should be done. And before we do all of the exciting extra things too, we can do those in parallel. We don't have to just do the exciting things. We need to really work on the basics. So I love that Angelo asked that.
Mm-hmm. What about you, Henry? I'll put it up for you again. Go ahead.
I have a couple of thoughts on this. Well, first of all, in terms of we need to solve the basics. I think generally, like innovation as a whole, it's the Maslow's pyramid concept applies. Like you have to deal with the basic needs before you innovate and you move up the chain. So people have to they have to be fed, they have to have a roof over their head. The basic reasons why somebody purchased a system or implemented a process that has to work before you can move on to the next level of like innovation, of improving the status quo. In terms of why do I think the current players in the industry haven't solved some of these pressing issues, I honestly feel like I had the same question, to be honest. Like why, before we started clinically, why does this problem still exist? How come it's not solved yet? And the only answer I could have come up with is just folks don't stick around long enough in the industry to fully see the problem solved. So it seems like specifically clinical research, it's an underserved sector, underserved by technology. And I suspect what ends up happening is just you have, again, the financial engineering come into play where smaller organizations get bought up by bigger organizations, and since you're a bigger organization, you can't focus on the small sites. You have to focus on the larger revenue producing entities out there. So you have to work up to the CROs, the sponsors, and then the smaller entities are left basically fending for themselves. And I think that's the only reason I can think of, because there's no regulatory reason why a lot of these issues exist. There's no technical reason because they're solved in every other industry. So it ends up being just the will or the capital, and I don't think it's the capital, because this industry is quite large and there's plenty of folks will pay for these problems to be solved. There's not a capital issue. I think it's purely just a focus issue where the vendors decide, it's a conscious decision to not focus on sites for whatever reason, and focus elsewhere.
Mm-hmm.
And that's really the only reason I would love. I always ask this question when I meet folks, or not this exact, but a similar reason, like why does this problem still exist? Like how come, eReg or why are electronic systems so disconnected, and why do they not work well when they seem to be working everywhere else in every other industry? And the same answers I get back are usually, oh, it's regulatory environment. Well, that's not true. I come from financial services where we have the SEC instead of the FDA. So the financial services industry is just as highly regulated as health. So it's not the regulatory, it's not the technology, because it's the same technology. So what is it?
So I have a theory, and I'm going to come back up to this again. What really hits me about this question, Angelo, is the word pressing problems. And I want to use an analogy, and then I'll combine it. But let's just say that you're at your house right now, and your house springs a leak. The pipe starts bursting, and you've got water everywhere. And all you pay attention to is the floor. You say, "Oh my gosh, this floor is wet. I'm going to go grab a mop. I'm going to go clean up this floor." And then you come back an hour later and there's more water on the floor and you don't know why. And finally, you realize, "Oh, maybe I should have fixed the pipe or turned off the water instead of constantly mopping the floor." I think this is what's happening here. And so part of it is about following the money. So let's say, who has the money? They call them sponsors for a reason, right? So sponsors come up to vendors and say, "I have a problem. This is my problem. I want you to fix this problem." And so the vendors say, "Okay, I will fix your problem." But going back to the root cause analysis that we were talking about, vendors didn't realize that that problem is actually secondary. It's downstream to the root cause problem, which is actually at the site, at the primary, the front line. You are continuously mopping the floor, which means you're continuously going to have water on the floor. You don't go to the primary source to shut off the water, to fix the pipe, to actually fix the problem. You're always just fixing consequences because of who is paying the bill. Sponsors are not feeling the pain of the root cause. Therefore, sponsors don't necessarily want to pay for the solution of the root cause. They want to pay for what they are experiencing. And I really wonder if that's part of why we see pressing problems in the industry not being solved, because honestly, Angelo, I don't think we know what the pressing problems are yet because we haven't explored them. That's my theory. What do you think?
That's a really interesting take, and it reminds me of the Ants movie. Do you remember the movie Ants with and they had the grasshoppers, and then the ants realized all of a sudden, hey, we're stronger together and we can go against these grasshoppers. I feel like the sites are kind of like the ants and the grasshoppers are like the sponsors. Having come from the sponsor world, I'm going to tell you, sponsors are not intentionally mean and they're not intentionally trying to steal your food. Okay, I just want to be clear on that. But there's still that important thing that sites sometimes I don't think realize how strong their voice can be if they do share their voices. And since different groups, just even like your SOS meeting, right, of bringing these people together and finding out, like, what are your key points? What are the problems you want to be addressed, and being able to funnel that up in a data-driven model. So I see there's another question there to talk about data-driven. That helps sponsor companies to say, oh, this is really helpful. When we were working in innovation at Bayer, one of the things that we look for is if we started having sites come in and they ask for a certain vendor, like all of a sudden we listened. We were like, hey, what's going on? Why are they asking for this vendor so much? Why do they care enough to ask for this vendor? That was very strong. If people said, hey, I will not participate in this study because of this vendor, that was also very strong. Like, why? Tell me more. Why are you willing to stand on the hill for this? So sites do have the power and the voice. If they can find a way to kind of bring that all together. But even just talking to your CRA and telling them, look, add this to your report that we really need help here. We really need help with XYZ, whatever that is, that will get somewhere, right? Yeah.
So
Henry, what do you think?
So I would take a step back from that and say the minute the sponsor is telling the site which technology vendors they should use, that the process failed. Like ultimately, does the sponsor really care if they're using my system or my competitor system, as long as they get their data, right? Like and I know this is like,
yes, they do care.
it's they care about their data, right? They only care about the system because I think some of the vendors out there, some of the systems out there are subpar and they've gotten burnt. But at the end of the day, as a sponsor, like I want my data. I want these data points at the end. Tell me which system you're using, and maybe I'll do my own due diligence to make sure that they're Part 11 compliant, they're validated, they're et cetera, et cetera. But at the end of the day, I need my data. So now it's up to the sponsor, and then this is the format that I need it in, or this it's got to be compatible with CDISC or whatever. And now it's up to the vendor to say, like, the site comes to me and says, like, well, we want to use your product. I'm like, okay, but in order for us to use your product, you have to be able to comply with the standard. Well, guess what? Now I'm incentivized to comply with that standard, and so are my competitors. And all of a sudden, that, like, you guys should use this system or that system, all of a sudden, all that goes away because the sponsor knows that whichever vendor the site chooses will be able to give them the data that they need in the format that they need it. So it's that's my previous point, where I think I know this doesn't work that currently, and the devil's always in the details. I totally get that. This is not like I didn't just provide a silver bullet to the industry, right? However, I think generally, like, folks end up going, like, too low level. Like, I want this data delivered through this system provided by this vendor. Do you really care? You need that data in a certain format at the end. If you just get out of that mindset that we're going to have to dictate who, what, how, why, it opens up the site to innovate a bit. It opens up the vendors to compete more, because now I need to be able to conform to this standard and provide this format. And all of a sudden, you get more interoperability. I can't pronounce that word now. My mouth is dry.
So, and that, I mean, aside from CFR, 21 Part 11 compliance, are there standards in the industry to follow for vendors? Like, what is the, let's follow the standard so that everyone can do this?
Yeah, so there's a lot of different things out there that talk about so the sponsor has to be able to digest the data that we want from the vendors that are out there. So we have to have that in a consumable format, right? Which is step one, which we can say you got to use FHIR, we got to use whatever it is, right? To be able to transfer that data. But the other thing is we have to know that when we get audited for this or inspected, when it's time for us to be able to file our submissions, that data is still going to be there and accessible for those inspections. And that's where the scary part is for sponsors, because there's so many little vendor companies, they come up and they're gone in 5 years. They're not there anymore in 25 years when we need to have that inspected. So this is a very scary thing, and it's a very high risk thing for sponsor companies to have to digest, because they could spend millions of dollars on trying to get this drug to market and have it fail because a third of their sites use this vendor that went under and we have no access to the data.
Yeah. So if I came up to you and I said, okay, Michelle, I'm using Bob's Research Emporium data storage, or if I said I'm using AWS, you'd be like, oh, okay, odds are AWS will probably be around in 15 years.
That's the tricky thing.
Is that kind of the concern?
Yeah, that's one of the concerns. Now, from an innovation mindset, I think bring your own tech is the future. That is where we're headed. It needs to be where we're headed, but it also is going to have cost implications on both sides, because of the fact that sponsors normally pay these vendors. They won't pay them anymore. The sites are going to be paying them. So then we're going to have to figure out, how do we include that as overhead cost, for the sites, and how do we figure out the fair market value, which we all know is questionable if it's fair, but like, what does that look like, right? But I do think that's the future, but there are those guardrails, like Henry was saying. At the end of the day, we want our data, but there are more things, and you need to be able to say, these are the things that we need, and then we need to hold the vendors accountable to that. But one of it is, how do we have the appetite to let these new companies in when we're so afraid that it could cost us millions, if not billions of dollars, and make patients wait an extra 20 years to get a solution because we chose a vendor that went away? And it's really the patient side. Imagine if that's your parents or something, and they're waiting, and this could have went to market, but that vendor went away. Like, that's a hard pill to swallow, right?
Yeah.
So we have to think it's beyond the sponsors just wanting it. It's also way more easy to have
Yeah.
one vendor that you're working with than trying to figure out how do you deal with all the bugs and the issues for 15 vendors possibly. And there's thousands and thousands of sites out there. So if they all pick different vendors, like that maintenance on the sponsor side for digesting all of that and all of the little links that have to be there for the integrations, there's a lot involved. So it's not an easy task, but I think that's where we're headed. We've got to figure it out.
So maybe like some kind of a standard for longevity succession would be, maybe that's not present. So Henry, let's say, I mean, clinically is never going to disappear. It's pretty much going to own the industry. But let's just say something happens to clinically. What would happen to your data? Like, where would that go?
Our sites would get it. They would get their data. They would get their audit. I mean, let's start with the fact that their sites can download their data right now without needing to contact us. We don't. We are the custodians of their data. We are not holding it hostage. So they can, and a lot of our sites want their data at the end of the, we archive it indefinitely in AWS. We happen to be in AWS, but a lot of our sites, I know, download their ISF at the end of the study, and they download their logs because they feel more comfortable having it on site, and that's fine. So should we go away, we would obviously make sure that everybody has their information. However, so this problem is not unique to financial services industry, and I'm sorry, to the healthcare industry. And the financial services industry, when we had contracts with vendors, they're frequently, especially if it's a key accounting system. So we would have part of the contract, part of the legal contract is that the code would go into custody somewhere, so that we can have access to the system, to the code, should the vendor blow up. And there were also provisions in the contract that should the data, should anything happen, you are obligated to provide us XYZ in this time frame, et cetera, et cetera. So these contingencies are not unique to healthcare, but yet in healthcare, they're used as a reason to not innovate. Now, I see Michelle's point about, from the sponsor side, do you really want, you got 20 sites using 30 vendors, all of a sudden you have 600 vendors you have to deal with. Well, good luck with that.
Yeah.
But currently the situation is flipped. So now that each site has to deal with 30 vendors across 16 trials. So the complexity got pushed down the chain to the site. So neither solution is sustainable. Like neither end state is sustainable.
Yeah, and that makes sense. And coming back to what you were saying, Michelle, like if you just read the CTA, it's on the site to ensure record retention, not the vendor. And I like Henry's answer because that's exactly what a site should be doing. It's not like you should just say, oh, I'm hands off, like a sponsor with a CRO. I'm hands off. It's the CRO's problem. Sites don't say, I'm hands off. It's my data vendor's problem to handle my document storage. Your data vendor did not sign the CTA. You did. So you have to be responsible for the management, safety, security of that data by the vendor that you choose. That's the other, that's the risk for sites, right? Why should I be putting my neck on the line for something that a sponsor is selecting, especially since I'm the one signing the contract? So there's all these weird things. I do want to take a step back because I want to talk about Calvin's question. Thanks for tuning in, Calvin. Calvin said, in light of the upcoming Fedora regulations emphasizing diversity in clinical trials, how are technology vendors assisting sponsors and researchers in defining diverse patient populations using data-driven approaches? So I think what Kelvin is touching here is EMR scrubbers, how we're going to use technology to identify diverse patient populations. But the challenge with what Kelvin is saying is, in order for that to work, those diverse patient populations will have to be in a database somewhere that we're pinging. And sometimes I wonder if the diverse patient populations we're targeting aren't necessarily in databases yet. So what do you think, Henry? We'll start with you.
So two kind of thoughts on this topic. From the vendor perspective, it's a question of data capture, capturing the right data points to identify a minority or etc. From the site perspective, or from the general outside of the specific like technical solution, it becomes more of a human problem. Their system can't solve. At the end of the day, as a site, you serve the sponsor, and the sponsor wants a diverse, the sponsor of the FDA really wants a diverse population. It's your job to go out and find them, and there's no system out there that's going to help you, because a computer can't knock on doors yet, ask you if you can fill out a questionnaire if you're interested in clinical research. So as a technology provider, I'm very limited in how I can help, I think.
Yeah, you're only given so much. And honestly, for me, as a site too, because sponsors, they've been trying to ask for diverse patient populations all the time, but I'm sitting here like, I can only give you what my community has to offer. I can only give you what people are willing to do in my community. What are your thoughts on this, Michelle?
Yeah, so diversity is near and dear to my heart. As I had my best friend's little sister ended up getting diagnosed with breast cancer, and she came to me and asked about the data supporting the therapy that they were going to provide her on women of color, because she wasn't sure it would work for her, because there's so many things that don't work in that patient population. I could not find the data. So I'm a huge advocate for diversity in clinical trials, because I don't want to have to be asked those questions and not have answers. And it was a big piece that we worked on within Bayer to try to figure out how to bring in diversity in clinical trials. And we hit a couple of roadblocks, and we know what the benefits are of bringing it in, but the roadblocks are we didn't successfully get that information captured from patients on a consistent basis. There's a lot of people who do not choose to enter what their elements are, and if they're from multiple different races or backgrounds, ethnicities, how do they answer that in these forms? That those aren't coming across. So even when we do have data, whether it's good data or bad data, we're not sure. And if we're looking at data from insurance companies, sometimes some of these diverse populations don't have the insurance from the ones that we're purchasing. So to your point, Dr. Fox, I think that's that's also a serious thing, is they're not going to show up in our systems the way they need to. But even when we're able to do EMR scrubbing or to be able to access big population data, like there's labs now that you can also check if it requires that first step of them identifying that they fall into that category, right? So we have to get that fixed. And then there's also the awareness of the clinical trials in these populations, to be able to try to reach them. And while we don't have computers that can knock door to door, we can do text campaigns to see if people in these, we can geofence a community and send out a text, hey, are you interested in clinical trials? We could do things like that. But are people going to trust it? Probably not, right? Because there's that added level that's there too. So this is definitely a big area that we need help with. And it's going to take a little bit of time, but the fact that we have these requirements now saying you need to be intentional in what you're doing, you need to be thoughtful in your process, you need to have a plan, you need to be forthright about how you're approaching this, that's going to move us in that direction. And that's going to get people on board to be able to have the data that's necessary for those data-driven decisions and resources that are available. But to Henry's point, it's a people problem. It's not just a data problem, So we have to have the people feel comfortable and trust the system. We have to have the people who go out and talk to people about it, once they're identified. So there's still that human element, that connection element that's necessary to be able to get this. But the fact that we're really moving in that direction and we're putting effort and policy behind it is huge. So.
Mm-hmm. Well, and most importantly, and I think it's like what we both said, technology depends incredibly on people entering the data. So what data you're entering, who volunteers the data, who's going to enter the data, that's going to be on the site level. We are looking at a decade of changing the diversity complex. And it's not going to start with the database. It's going to start with the relationships that result in entering of data. And we're just barely scratching the surface of those relationships.
And we can't expect every site to cultivate a diverse population, because
Nope.
to Kelvin's second point there, if that is not the community, then it's not the community,
You
right?
cannot force it.
So,
Your only solution is to have multiple sites across the geographical region that are targeted to diverse populations. You
mhm.
can't expect everyone in Idaho to go to a single site. It's not going to happen. Or, you pick your state, whatever it might be. You have to have little bitty footprints in the community of the patients that you're targeting. You cannot expect them to uplift their lives, to be a part of research by traveling 9 hours away. It's not going to happen.
Yeah, and that's where I think we can really benefit from the technology to create the flexible clinical trials that we need to reach the diversity element. But again, then they have to trust the technology and have access to the technology and all of those pieces too. And diverse doesn't mean that all of a sudden you are the bottom third of the community either, which is the one thing that frustrates me a lot, because everybody says, oh, well, if they're a minority, they must be down here in the lower things and they can't afford anything and they can't get anything. And that's not true. There's a lot of middle and upper, in these areas too, but we need to try to think about all of them.
All right, Kelvin did it. Kelvin, this is an innovation podcast, but we'll touch on it. We've only got a couple minutes left. Henry, do you think DCT is going to solve the diversity problem?
It has the potential to, but I haven't seen any evidence to suggest that it's working.
Yep. Okay. What about you, Michelle?
I absolutely think that it can be a catalyst for change. And the reason, because I don't like the term DCT, so whenever I talk about it, I always say flexible trials, but just know that's Michelle speak for DCT. When we create the flexibility in our trials by adding in more opportunities to have telehealth visits and to have come to where you are or use things within your community in order to complete what's necessary for the trial, this opens up more access to more people who couldn't participate, of all backgrounds, right? So if you're opening up that floodgate, then that also means the diversity element has more options too, right? The other piece of it is, if we open it up to more community-based things and more diverse providers, we will also get more diverse patients and participants. So I think it has much better chance than doing traditional trials that we've done for the last however many years, right? So I think it has a catalyst for change, but it is not the solution. It's not the solution, right?
So, and Kelvin, I'll pipe in here because this is something I feel very near and dear about. I do think that what we consider as the process of DCT, what the FDA is currently approving as DCT, has the potential, as long as it all depends on who owns the tech, right? As long as the community sites, the people who are forming those relationships with the physicians, as long as they are the ones controlling the tech. So the sites are choosing their DCT platform just like they choose their CTMS platform or their eReg platform. That's going to work. If you try to make DCT talk down tech or subversion, where we just don't need the sites, we'll just do this away, or if you try to make it any way that diverts that community relationship, it's going to fail. And Henry, I think that's why you haven't seen the evidence, because so far it hasn't necessarily been something that was controlled by the sites. It was always some kind of a centralized national, this is what we're going to do. We are going to be this big national thing, getting boots on the ground, trying to help communities. That's not going to happen. You're going to have boots on the ground. Even if you turn into some kind of a franchise system, you have to have that in-person relationship if you want diversity. So that's my theory. We are on our way out. We're actually an hour in. That was a great time. So let's go ahead and wrap up real quick. I'm going to ask you one more question, and then we're going to end this. So Michelle first. How can we help you innovate the industry? How can our community help you innovate the industry?
I think the biggest thing is being willing to share your voice, because I have clients all the time who want to hear from different sites or, different experiences and stuff like that. And when we reach out and people are like, oh, I'm too busy, I can't do it, there's one thing about just grumbling about a problem. There's another thing about being part of the solution. So if you ever get invited, please say yes, if at all possible. So
do not be afraid to speak up. And I think that that's really, really important. I think oftentimes we do have stakeholders who are afraid to speak up. They're afraid of being punished. Henry, what about you? How can we help you innovate the industry?
It's a topic that's very dear to my heart. Just complain. Just tell me what's wrong. Nothing's gonna change unless you complain, unless you tell us. And to your point, Dr. Fox, like myself as a vendor, like what am I gonna do? Fire my customer because you don't like my product? Like that's not a thing. So or Michelle's point, just you gotta tell us what's not working. That's the only way we can improve.
Speak up. Speak up.
Yes.
Speak up. P.S. Speak up.
Yes, and more importantly, about the things that aren't working. The things that are working for you, that's great, but I almost don't want to hear about it. I want to hear what we can do better. Like that's value. That's the feedback that's valuable to us, and that's the feedback that's valuable to the industry.
I like both.
Yeah.
Sometimes we need to know that there's something we did right too, so we don't just feel like failures and we lose all of our motivation, right?
We don't want to gripe fest.
Yeah. And we also don't want to mess up, because one time I did a workshop and they were going to get rid of a good part and they didn't realize it was a good part, and it's like, oh no, don't sacrifice the good to work on something new. Like that was really helpful. So sometimes we need to know the good too.
So I do have to say one thing. This is my selfish CRPN plug here, but I kind of mentioned it to Henry. CRPN site partners now have a service line for beta testing for our vendors. In other words, vendors can join CRPN. They can pay a premium, access all of the sites they need across a huge realm of experience so that they can thoroughly perform what we call a tech trial, a beta test, a user interface testing for their product as a part of being in the network. There's over 100 sites now, and about half of them have signed up for user interface testing. So odds are you have a ton of people who have already signed up and said, help us. On top of that, you pay sites for what they're doing. You're going to get high quality. And importantly, sites can afford to open up their doors to you. That's the biggest complaint for sites is everyone says they want the site voice. They can only have so many hours in their week where they can give it away for free. So why not be a partner? Why not be a member in CRPN? There's my plug. That's all about as far as I'm going to go. Thank you, everyone, for watching CRPN Central Live. Thank you to Henry and Michelle for coming on and sharing your experience. And be sure to tune in next time. We've got a lot of these live events coming. So thanks, everyone.
Thanks. Have a great
day.
Bye, everyone.
All right. Bye.